We've long known that primary care has a central role when it comes to cancer care, particularly for prevention, early diagnosis, but increasingly in the management of cancer itself, not least because for many of the cancers, people are living longer and surviving longer with treatment. And if you ask any patient what they want most from a successful treatment, they don't say, I want to live forever. They say, I want normality. In other words, what they're saying is they want back what they lost before cancer touched them. And primary care is normality. Lying in a hospital bed with a drip in your arm, that's not normal, but primary care is. There are some problems, of course, because primary care is not the same all over Europe. And some have very developed primary care and some don't. So for some tumor types, it's excellent. And for other tumor types, maybe you need to go back into hospital more often. But nonetheless, the future of primary care and cancer care are absolutely central to quality cancer care in the future. I do wish that the quality of cancer care was standardized all across Europe. I do wish that we had the same level of quality of cancer care for all of the tumor types, but I'm afraid it's not true. And the inequalities are intense, both in terms of geography and in terms of the tumor type right across Europe. And this is a catch because we have a European Union. Is a Romanian patient less European than a patient in Rome or a patient in Paris or a patient in Dublin? No, they are equal. So why have we got different levels of quality cancer care? Not just about one tumor, but about other tumors. So we want to see quality cancer care for all of the tumor types right across Europe. There are differences, obviously, in the quality of cancer care across not just Europe, but across the world. In some parts of the world, of course, there is very little primary care. When you look, for instance, at the States, it's a completely different system than we have, for instance, in most parts of Europe. But what people are starting to realize is that you can't do all cancer care, particularly for prevention and early diagnosis, in big hospitals. It is much better to do these things out in the community. And anyway, this is exactly what patients want. They want to have accessibility to healthcare in their immediate region. And what tends to happen with cancer care, of course, is it is localized into centers of excellence. And they may be many miles away from where people actually live. But for things like prevention, things like early diagnosis, and things like management in the long term, primary care is ideal. ECCO, I'm delighted to say, has just recently published a paper called the Essential Requirements for Quality Cancer Care and Better Integration of Primary Care. And it has been revolutionary because for the first time we now have, if you like, a checklist of all of the things that is required to produce quality cancer care within primary care. And we're not just talking about general practice. We're talking about the community pharmacists. We're talking about the nurses, the dentists, the opticians. They are all part of primary care. If you like, they are a multidisciplinary team, which is what ECCO has been saying we need all the time. So it's so exciting to see primary care now being fully integrated into that cancer care. So it is now seamless from prevention, early diagnosis, critical care, management. Now it is seamless, and that is what patients want. They want to have continuity throughout their treatment, and they especially want to have better contact with their own doctors, dentists, opticians, pharmacists. It's marvelous.